The first time people in the U.S. can order birth control pills online. We're talking about Opill, and orders opened up this week.
Right now, it's available on the drug maker's website and Amazon.
So the drug maker's website also shows that stores in Houston will carry that medication. And the list of stores includes CVS, Walgreens, and Target pharmacy locations. This was approved by the FDA last year. The company says Opill is 98% effective at preventing pregnancy. So to get the medical perspective, joining us this morning is Dr. Cindy Selnick, Chief Medical Officer at the Women's Hospital of Texas. Thanks so much for joining us, Dr. Selnick.
Thanks for having me. Good morning.
So, you know what, we've been reporting on this saying that, the over-the-counter birth control was coming. I didn't actually expect that they were going to have online orders. Is there any way that you prefer a patient go about this, to go over the counter or to get it online?
I think either, whatever is more convenient for the patient. The big thing here is that there's access, improved access, and you don't need to see a physician to get it.
I'm sensing a little bit of approval in your tone. You approve of this?
I do, and I'm sure most OBGYNs do. Certainly, we want improved access so that people can prevent pregnancy if that's what they choose to do.
Why are you so in favor of it?
Well, there's a lot of reasons. One, as far as Texas, almost 90% of our counties have healthcare professional shortages, and so it really is hard to see a doctor in some of these areas, and so access is limited for them. We have a large uninsured population that also is going to benefit from this. And then typically minors usually require a parental consent for this, and this will be different. They will not. So again, there's a lot of opportunity here to help people get what they choose.
Yeah. Dr. Selnick, for folks listening right now, patients listening right now, should they still consult a doctor after ordering birth control online?
I always think it's wise to make sure your physician knows what medications you are on. And certainly if you have any concerns, for example, after starting it, if you have side effects that are concerning, like headaches that are significant irregular bleeding, those type of things, I would certainly involve them.
What would those be? What would those signal if you were getting severe bleeding or headaches? Is that a signal that maybe the birth control could harm you? Are there people who are at risk of taking birth control?
Well, it may just be something that you can't take. There are people that simply can't take some medications, although I think with this it's really rare. We have been giving a progesterone-only contraceptive for many years, and it is well tolerated. And according to the pill package, the only people that cannot take it are people that have or have a history of breast cancer. And I agree with that. Yeah. It is very safe. But it doesn't mean that if you're having symptoms that are new and different and significant, that you shouldn't talk with your doctor and consider that maybe it's not for you.
So this over-the-counter is a progesterone-only pill?
Yes. Most traditional birth control pills have both estrogen and progesterone in it. This does not. It has progesterone only.
So that somehow makes it a little safer, as you mentioned, for patients who may be intolerant to the estrogen, I guess?
Well, estrogen does carry some slight different risks for some people. For example, with migraines, et cetera, a history of blood clots, et cetera, they may not be able to take a combination pill. And so this pill offers a little bit more opportunity for those type of individuals.
Okay.
I feel like I've been sitting in a Spanish class, foreign language. Learned so much this morning.
Yeah.
Dr. Selnick, is there anything else you'd like people to know before we let you go today? What should they know about if they're seeking birth control over the counter now?
Yeah, I think there's something very important to know that I tell my patients that take progesterone-only pills, and that is that you have to take it around the same time every day. This is pretty important. Usually within 2 hours or less. If you miss it by more than that, you are not covered. So what you would have to do is take the pill as soon as you remember, since you missed the window, and then wait or make sure you cover yourselves with another form of protection for 48 hours. So it really is important. Set your alarm, put it by your toothbrush, find a time you're going to be able to take it regularly every day.
So, okay, so and then if you miss it, you have a two hour window, in which case you'd have then 2 days that you'd need to use an alternative protection.
Yeah, if you miss it by more than a couple of hours,
Yeah.
then you need to assume that you need to double cover for 48 hours.
So we've been saying that this over-the-counter pill is 98% effective, but that's only 98% effective if you're using it correctly, which includes taking it at the exact same time every day.
Correct.
Yeah, that's a really good point. Good information. Dr. Cindy Selnick, Chief Medical Officer at Women's Hospital of Texas, thank you so much for your time this morning.